things in more of like a visual format. And so that was how I approached the group setting. So like towards the end, after there was like a little lull, it's like, okay, so can we to recap like what the points have been made? And then I also kind of drew a little visual of what people were talking about. So that was kind of my personal approach.
Great advice.
Alana.
Hi. Yeah, thank you all so much. This has been very helpful. I'm Alana. I was just wondering if any of you were concerned about like sharing the same personal experiences that you had already written about in your application, because I know I have maybe 4 or 5 personal experiences that I would really like to share in an interview that probably stand out the most among my application, but they're also the same experiences that I wrote about in my primary and or secondary essays. So I'm just wondering how you all navigated that.
That really resonates with me. I feel like that's such a like a knee-jerk feeling to like not want to, you want to like pack on everything about yourself in every crevice that you can think about, as you go in. But in reality, I mean, as my example with ECU, like it was a bad decision to like try to think whether or not the interviewer had read my application. So I would say, as a short answer, I would say go for it, because my perspective is that the way you speak about something is honestly sometimes more telling than the way you write about it. And you can display that passion, you give more information, and oftentimes like they sometimes I think the interviewer just like has not read anything. Sometimes they're intentionally blind to your application. But I think whatever comes to your mind when you get a prompt.
I would also agree to that. Some schools will actually tell you if the interviewer is blinded or not to your application. So I think actually most of my interviews, they all said that they don't see your application at all. So I would say like definitely speak about like what makes you passionate, because they're obviously going to ask you like the why medicine, and most of the times the why medicine are all these experiences you've had. So yeah, definitely use it, because most of the time they have not seen your application. I think one of my interviews was technically open, but he definitely did not read my application because he asked me no questions about my application, just literally just started having a conversation with me, didn't bring up anything. So definitely like speaking on like David said, like yeah, what you're passionate about will show like as you speak about it. And I feel like that's really what they're looking for, instead of you just listing I did this, and this. Like really showing that passion about something shows them that like you're really interested in this field.
Thank
You
you.
can't do that in your application to some extent, right? You're limited by character count, and you can't really, oftentimes it's harder to get that enthusiasm across. So take advantage of it.
Other questions? Has Ted joined the line? Ted, if you have, please.
Not seeing him.
Not seen him. Okay.
Mm-mm.
Hudson, go ahead.
Hello, thank you all for being here. I was kind of curious just about logistics of like, when does the interview happen? Like, do they send you days to pick from, or like are these on weekdays? Like, should I plan to take off work, or like how does that all happen? And like what's the like any tips for like the day that you chose, or how quickly you responded to their email once they, told you you had an interview? Just like how does that happen?
I'm sorry, do you want to go, Amanda? I'd say all of the ones that I have they're going to be on weekdays, and so yes, you have to take off work. Some of them were like just an afternoon, so I went into work in the morning and then was able to come home. For the one that I had to travel for, I had to take a full day off work, so I would just kind of plan for that in advance. Usually, most of my interviews, like they told me I had one at least a month or so before it would have been scheduled for. So you do have some time to like figure that out. And they'll all send you in offering you an interview, usually a couple of date options. And then they'll tell you how quickly you need to respond to them. So it was usually within a couple days. But they gave you enough time to kind of make plans and like, because I had to travel to one of them to like book a flight and that sort of thing.
Yeah. But you would want to respond fairly quickly because again, that shows interest. And I see now that Ted has joined. So why don't we pivot there and then we can circle back on this. Thank you for joining, Ted. Can you introduce yourself and share your dental school experiences?
Yeah, of course I can. Can you guys hear me? Fine?
Yes, we can. Thank you.
Perfect. Hey everyone, my name is Ted Pasquette. I'm a current D1 right now at UConn Health. I graduated Davidson just this last May. And a couple of things I was involved in at Davidson included the Pre-Dental Society. I was a member of the Honor Council. I was a Posse and Bonner Scholar. I was also part of a fraternity. And I also was a model student advisor where we pretty much talk with professors to ensure a more equitable teaching environment. Out of the schools that I interviewed at, so gracefully enough, I was able to get 8 interviews out of the 11 schools that I applied to. These schools included Columbia, Penn, UConn, Rutgers, University of Southern California, Meharry in Tennessee, and a couple more others I might be forgetting. But essentially, I think one of the main important things you should consider is that, you know, you've done your application and you've submitted all these different materials. But the main thing is that you really do know what's inside your application, because come the interview time, you're essentially talking with these admission officers in order to display that you know who you are, and that's also a part of the things that you place in your application. So if I can give you any tips or any advice on what to do is, you know what you're writing on your application, but also make sure that you know it like the back of your hand, because you should be expecting questions about any aspect of your application. And of course, the admissions committees also will want you to be able to clarify and repeat these things in a way that's very natural for you. But aside from that, I'm really open to anybody who's willing to contact me as far as, you know, they need any help with their application or any interviewing tips that they need. I can always offer any help with that. And you should also take advantage of the Career Center in terms of doing mock interviews. It's a great way to get that practice firsthand before you actually do your interviews. I think, you know, once you go through it once, you get more comfortable with it. And each time you do it again, it just becomes repetition and it really doesn't feel like anything. So really take advantage of those opportunities. I know my first interview actually was with UConn, and I'm here now, but I think every interview after that, it just got a lot easier from time to time. So really just taking advantage of those resources. And as far as like involvement goes, I was pretty involved at Davidson, like I mentioned before, with all the things I was a part of. But I think, you know, you should really, you shouldn't strive to do too much. You should really pick those few things that really matter to you and keeping and sticking with those for the long term time. But again, you know, very happy to help anybody out if you need help with anything.
That's so kind of you, Ted. Since you're making that offer, can you drop your email into the chat so that folks know how to contact you? Appreciate that. And I want to actually just give a few minutes to Dr. Thomason. He's a longtime physician, Davidson alum. Dr. Thomason, you have kindly offered to do mock interviews as well. Did you want to say a few words?
Yeah, and cut me off if I get too long-winded here, but yeah, I'm happy to be here. I've been doing this for a couple of years. I just had my 50th reunion this past June, so I've been around Davidson a while. There are about 2,000 grads over the last 40 years from Davidson that are in healthcare in some field. So we need to figure out a better way to take advantage of making those connections, and that's kind of the job of what we created as the Council of Alumni Healthcare Professionals, or CAP. So I'm the chair of that right now. I work with Nyla and Aisling. And first off, I want to compliment both of them for putting this together tonight. Nothing can be better than hearing from young grads, not old guys, that are just going through the process you're going through or getting ready to go through. It's invaluable. So thanks to all of you for taking time out of what I know is a really busy schedule to do this. That can't be better than what you've had tonight. I would reemphasize a few things. Practice as much as you can. I think it's great to practice with roommates or others, but we really hope to offer this as alums And we've got a spectrum of alums, not just old guys, but others as well. Every time you do an interview one-on-one, you're going to have a different experience, whether it's with me or somebody else. And that's an invaluable opportunity to get you a little more comfortable in the environment that you're going to be in. Everybody's anxious. Nobody can tell you they're not going to be, right? So it's just the way that's part of the process. A couple of tips that you've already heard: be yourself. Don't try to be who you think the interviewer wants you to be. Just be yourself. You want to leave an impression, and you don't want to put too much pressure on yourself. You don't want to be bizarre or weird, to use the current catchword, but you want to leave an impression that sets you apart from the other hundreds of applicants that, frankly, you're competing with. And I think David said that whatever it was that you had a passion for, that stood out, and that's memorable, right? So the interviewer will remember that, something unique about you that fits in some way with your desire to be a healthcare professional. I do agree that you want to know the questions that are going to come at you. I think Lyle said that well, but you don't want to script your answer. That's really important. You have to be spontaneous and natural, and you don't want to have a memorized answer that you're feeding back to somebody. Oh yeah, strengths. Okay, 1, 2, 3. I mean, you want to be able to respond, but as yourself. And the best interviews or conversations, that's also easy to say and hard to do, right? But think about it as though you're having a conversation with a favorite professor or somebody like that. It should be a two-way street. Remember, they're recruiting you as well as you being interviewed by them. And so someone said, I think, Lala, have some questions prepared, and they should be things that you can't just find on an internet search, right? Something about that school that's not just obvious when you go to their webpage. That's important to you, and it needs to be genuine. Don't just like come up with something that you think they may want to hear. Come up with something that's genuine that you really want to know. As far as blending your story in, I think being a storyteller is really important. You don't want to be too brief. This isn't a court of law where your answer should be just yes and no. On the other hand, you want to guard against run-on answers that just go on indefinitely, and there's a balance there, like everything else in life. A couple of things from the interviewer's point of view, not to be offended by. Some of the interviewers intentionally are the great stone face. You'll get no body language feedback of any kind. They'll just look at you, and don't be offended by that. Some people just use that as a style. They won't nod or smile. They'll just sit there and look at you. Sometimes they'll cut you off in mid-sentence if you're giving an answer. It's not that you've given the wrong answer or bad answer. They have a very limited amount of time to get to know you as a person, and they may have other things they want to ask. So don't be thrown off your game by that if it happens to you. Just sit patiently and wait. Silence is okay. I can't remember if Aisling had that in there or not. Now, not a 2-minute silence, but silence in contemplating a response is perfectly fine. Most of the advice is if you do that, don't like look up at the ceiling. People think you're trying to collect a memory you put up there. Maybe glance down a bit or something, but a little bit of silence is okay. And it shows, that you're a mature person that can't just blurt out an answer. On the ethical questions, you should definitely expect to get those. And remember, there's not a right or wrong answer to that. They just want to know how you think. And critical thinking skills are such an important part of your Davidson education. You guys are probably well versed in that, but that's really the purpose of what do you think about euthanasia? What about this Jehovah's Witness situation? Whatever it might be. They want to know how you think. And I think it's fine to listen to the question, whether it's an MMI question or a one-on-one, and then balance it, saying, well, there are two ways to look at this, but they want you to give an answer. But I think this is what you do. So I would encourage you not to waffle, when you're responding. It's okay to paint both sides, but at the end of that, balance it and say, but here's what I would do. Here's what I believe, or here's what I think. I think you definitely need to be conversant, at least, with healthcare policy broadly in the United States, whether it's the ACA or, what about primary care? You're going to get questions like that. And if you draw a blank when people ask you about Medicare, Medicaid, anything like that, you don't have to know that in great detail, but you ought to be conversant with current state of healthcare policies, challenges in America, and just be aware of those questions will definitely come to you.
Yeah,
a bunch of other things, but that's probably where I need to stop. Okay,
yeah. Yeah, I just want to leave a few more minutes for questions from the audience. But yeah, I have heard from students that interviewed last cycle that many of them were asked, what's the greatest issue facing the United States? And so you kind of need to have an answer to that one. But Allie has a question. So let's pivot there just with our remaining minutes, if that's all right. But Mike, if you have comments, put them in the chat so that people can
I put something in the chat. Please take a look at it. That's my plug for the CAP. Thank you.
Thank you. Allie.
Hi, thank you all so much for coming today and talking. For framing medical ethics questions and policy questions, did you guys have any recommendations on things to read, things to subscribe to, so I can like get that current information and be prepared to be conversational about it?
Yeah, I would recommend the bioethics program at Columbia University and Santa Clara University. Those are two really good resources. And with, you know, the policy questions, if you're nervous, can't think of anything, go to Access. Lack of access, that's always a good go-to answer.
I'd also say don't spend like 10 hours trying to like learn all of the healthcare policy and medical ethics and that sort of thing. I'd say honestly, I maybe spent 1 to 2 hours researching that total for my entire application cycle. I just wanted to make sure like I knew what Medicaid and Medicare were. I knew some current North Carolina laws about certain things. And I knew very general medical ethics. But I would say like focus much more on your own stories and how you're going to portray yourself as opposed to memorizing policy, because they know anyone can do that. I just would be able to like enunciate something coherent about that and maybe relate it to an experience you had or something like that.
Other questions?
Aisling, is there time for me to make a quick point here?
Yes,
Yeah,
please.
all of this has been repeated. I mean, it has been said, but I'm going to repeat these three because I think these are really, really important. When you're researching the school, again, demonstrate fit to mission. And the way to find those, you know, look for niche programs that different schools, medical schools have. And if your experiences align well with those niche programs, definitely connect the dots for them. It's all about fit to mission. Again, this has been said many times, be authentic, be yourself. You guys are awesome. You really are nice people. I know you, I've known you for 5 years, more than 5 years. You all are really nice people. Just be yourself. And it's going to be great. Again, this also has been said multiple times. Not all your anecdotes or stories about yourself has to be related to medicine, right? Because they do want to see your, you know, whether you're going to be a good fit to the medical school or dental school, their program. They also want to see if you're going to be a fun person to hang out with. So be a person. And we all are first, you know, we're people first, right? Before we're, let's say, a doctor or a dentist. We're people. So that's something I think it's helpful to keep in mind.
Okay, that's super helpful. I know we're right here at the 8:30 hour. So Dr. Mamoon, thank you for those remarks. I do want to just maybe, if for those that need to go sign off, maybe we can just have another question or two. And if our panelists need to go, I completely understand, because I did tell you 8:30 is a hard stop, but I know we've talked about a lot of things. Is there any, the MMI workshop is coming up. I did want to make a plug for those that are within an easy drive of campus. We are having a healthcare networking reception. It's for current students join at 6:30 p.m. But if you have already graduated, you come at 6 to meet with area healthcare professionals. And that is on Tuesday, September 17th, and it immediately precedes the Fall Research Symposium. Those relationships, while maybe not immediately valuable for the upcoming interview, they're invaluable for mentorship, for just advice. And so there's something to consider with that. And that won't be the only opportunity, but that is the one that's upcoming. There is an MMI interview practice coming up. Dr. Mamoon, tell us about that.
Yeah, that is on September 4th. It's from 7 to 8. Well, we have, you know, about another 30 minutes built into it. Did everyone, do all of you who are interested in the simulation, the workshop, were you able to get a spot? Is there anyone who was not able to, who would like a spot and wasn't able to get one? Because, you know, again, it's a little bit difficult to coordinate because the number of interviewers and interviewees have to be the same. But so if you weren't, please let me know so that we can offer some additional ones. But I really encourage you to take advantage of it because it's extremely helpful. Just going through the motion it can be very helpful.
Yep. Thank you. Any last questions? Okay, well, you have our interview in our panelists' emails, so you can follow up with them. And of course, you know how to get in touch with me and Dr. Thomason and Dr. Mamoon. So good luck. We wish you well. You're going to rock it. Okay. All right.
Thank you, Aisling, for putting
Thank
this
you.
together. You did all the work. I just suggested names of panelists. You all were wonderful. And thank you for joining.
Thank
Really
you
appreciate
so
it.
much. Thank you, our panelists. Really appreciate it. Take care now, everyone.